I'm going to stress the regulatory role of dealing with PI. Just to go over a few things a little bit specific to Kentucky, but certainly not total. Estimations, I think, the exposure rate and whether that's just positive serologies, probably in a lot of cases with BVD is 60 to 80%. It's endemic in Kentucky and in Tennessee too, Charlie. Probably everywhere. It has a huge economic impact. I don't even think we know how much it has because there's so many secondary things. Really important, and I think that's what Dr. Lee did such a good job of explaining, is it is a manageable disease, but it's a tough one to get people to talk about. If you're in various stages of cattle production, it affects you different ways, and I got hit right in the face from the backgrounders. I went to a KCA board of directors meeting, and there were some guys there who had total train wrecks, and they were mad. They wanted me to put some people in jail. When you start talking about losing 30 to 40% of a bunch of cattle that cost you at that time probably $1,000, $1,100 a head, they were looking at bankruptcy and being upside down in their whole operation. Not going into all the things that have already been discussed, but certainly that got my attention that day. We'd been talking about it for 4 or 5 years and just really never done anything. But it reached an apex when the market dictated really that it do that. The cow-calf people are a hard sell. There were a lot of cow-calf producers in that same meeting I was in, and they really didn't want to talk about it. They wanted to sell calves. Dr. Lee said it's kind of a silent thing. They weren't seeing a lot of signs. They probably didn't have records well enough to know that their calf crop was only 75% and it could be 90%, and that put a lot more money in their pocket. They weren't seeing it that way. But this should be our focus. They don't know that they can have a PI calf in their herd that's costing them a lot of money, just like the backgrounder can buy a PI calf from them and he have a train wreck. So the herd management problems are the way we need to go. We need to keep the veterinarian involved when there is one. In many cases, there's not. But certainly that client-patient relationship is the key. I did cattle practice for about 10 years before I got involved with horses for another 20 years, and now I'm a regulatory guy. So I've kind of seen it, but I didn't even know what PI was until I came to this job in 2003. And Dr. Lee, I don't know when we found out about PI calves. When I was in school, I either slept through that lecture or they didn't know about PI calves at that time. But it's a strange phenomena. It really is that a calf can be a virus machine and not be sick, not show you any kind of signs. It's a physiologic process that I can't get my arms totally around. These charts in here, and there's 3 or 4, and I'm not going to belabor them, are from an Alabama presentation that I stole. Alabama actually had a PI program. They've had it for probably 8 or 10 years. Dr. Gibbons from Auburn actually came to the KVMA convention last year and presented. The program is not real active down there. Even with the market as it is, it's a hard sell. They're not getting a lot of participation and not a lot of sustainability. But I think one thing on this chart that is important is to recognize those 3 different syndromes of acute or a transient infection, the fetal infection and the ramifications of it, and then the persistent infection that's demonstrated in calves relative to infection exposure to the cow at that critical period of 40 to 120 days of gestation. And I think I missed something there somewhere. Yeah. So I think this has been sufficiently described too, and this is just a chart demonstrating the different kinds of effect that you can have in the reproductive cycle depending on when the cow is exposed to the virus. But with persistent infection, and we're not going to belabor this either, but I think it warrants emphasis in that calf can look absolutely normal. Immune suppression is part of the whole process of that calf being able to shed millions of virus particles every day of its life with no apparent disease. And they do sometimes succumb to mucosal disease and acute death. It's interesting to hear Sandy's experience with that because I knew you guys were feeding them out, but I never really heard exactly what the results of seeing that was. Through our process of regulation, that's one of the options that I'll talk about later is to have an approved feedlot to put these animals. And it may not be really a moneymaker for anybody to do that. These are just the routes. The only thing I really want to focus here is that while the transient exposure of the dam is the 90% route of getting PI calves, you can have that PI cow in your herd, and she's going to have a PI calf every year. And those are about 10% of the calves that are at least estimated as to the source. So this has already been emphasized, but it is important to know that born a PI, always a PI. If it's not born a PI, it's never going to be a PI. And that there's no threat human-wise either to the virus or to the meat from the animal. There again, just demonstrating how important that PI calf in the center is to all of his herd mates, whether it's a bull, whether it's a fellow calf, or whether it's that dam that's pregnant. And there are control points, and that's kind of where my job now comes into play. We had some laws in Kentucky that weren't made for BVD. They were probably made for brucellosis, but what they said was you can't transport an animal with a communicable disease on a highway. You can't sell it. You can't give it away. It's against the law. And, you know, farmers don't like to hear about it being against the law if they want to sell a calf for $1,000. So a lot of people weren't real happy when we decided to do this, but we didn't want to do it in a punitive way most of the time. If it's a trader, it might be different, and we've been presented with that problem. But for the most part, we don't do that. But the control points, as I said earlier, are getting the veterinarian involved in a management plan, and I'm not going into what the details of that plan. Testing certainly is a good place to start to develop your baseline, know where you are. All the other things, the biosecurity, and have been discussed. I'm not going to get into this. I think that's part of the plan, and Sandy to address that, and the veterinarian is the one to talk about that with the herd owner. So you get into some statistics, and I stole some of our statistics because really we don't have them good, but everybody thinks there's about 4 in 1,000. Don't really know, but that's probably close enough for government work, as they say. This chart you've already seen. We stole it from Dr. Johnson, stole it from Dr. Hessman, too, and made this slide. But the concerning thing is it appears to be on an upward trend. I don't know if that will continue for the next years or not, but it's certainly interesting to kind of see because everybody's got their own opinion. I have a brother-in-law who he backgrounds about 3,000 cattle a year, and he doesn't think it's near this high, and he tests all of them. But others would swear that that's about what it is. When Sandy and I talked a couple of years ago, one of the concerns she had was that if we started doing regulatory measures on positive reports, it would decrease the testing. People would go underground, she'd be losing business, and we wouldn't have any surveillance. That hasn't, at least in my eyes, Sandy, hasn't been the case. You can see, I don't know about pointers here, but our Breathitt lab in western Kentucky doesn't do a lot of testing. Not a lot of cattle in western Kentucky anymore. They're raised in corn and soybeans. UK Diagnostic Lab, there again, does a fair amount of testing, but nothing like our 2 private labs do in Central States and Gold Standard. We're doing the bulk of our tests. So we're testing about 150,000 calves a year. I say calves because I would imagine that 98% of them are calves, and I don't know. And most of that's being done by backgrounders and not by cow-calf guys for sure. So what can you do when you find a PI animal? It obviously needs to get removed from your herd. You can't sell him at a stockyards. You can move him, but only with a permit from us. And to tell you the truth, we haven't issued very many, if any, permits, but that's what the law says. It has to be done. I think there's an awareness that has helped the movement of these animals. I think people understand the risk maybe more than they used to, and that they're trying to at least play by the rules of the game. So they can be sent to slaughter. You can isolate them and feed them, or you can euthanize them. And Dr. Johnson in my office has provided most of the contacts with the people that have BVD positive animals reported, PI positive animals. We're not responding to all BVD positive serologies, especially just to the PI positive animals. And in what, Beth, in 90% of the cases, they've already at least told us, and I'm assuming they're telling the truth, they've already euthanized the calf and put it in the ground in most of the cases. So we developed some guidelines to present both to industry and to our livestock markets, because that was one of the first places that we recognized a potential liability, I guess. And this goes to reporting. BVD is a reportable disease by our law. It doesn't say anything about PI, it just says BVD. So when the labs did start reporting, we got usually either a veterinarian's name on the report or we got the owner's name. We didn't necessarily always get that report in the first 2 or 3 days after the test. So we had a situation where a producer had a PI calf recognized, and it was about 2 to 3 weeks before we saw that animal come across our desk. When we responded to him, "Oh, I just sent that calf to the stockyards with a group of others." Somewhere along the line, the ear tag got removed. So we didn't know which calf it was in a group of 120. Well, the stockyards people are seeing liability all over the place. So they're calling me, well, what are we going to do? What are we going to do? The order buyer, he's not happy either that bought those. So we went through and tested 40 of the calves had already left. We couldn't do anything about them. Went through the other 80, and guess what? We found 3 positives. Now, were they really positives, or were they transient infections because there was one positive in there? We don't know. But anyway, we pulled those out, kind of closed our eyes, and sent the rest of them where they were supposed to go. But that's really not the way it should work. It ought to be a little more immediate so we can react. A chute-side test would be really nice. And Sandy, I don't know how you feel about the SNAP test. I've heard different reports, but most of them not great. But the sooner you know that you got one, especially if you're an order buyer, and you're going to put 80 of those calves on a truck headed to Kansas, when they're on that truck for about 15 or 16 hours, if you got a PI in there, he's got a lot of chance to expose a lot of animals. So it's a lot better if you can recognize him in the market, pull him out before you put him on the truck, than it is the other way around. All of our labs are now reporting. The interpretation of the test is something we got bogged down a little bit with. Was one test really enough? Did it really mean the calf was a PI? As near as I can tell, and I'd like to hear your analysis of this too, Sandy, but there's probably, if it's positive on an ELISA, on an ear notch, it's about a 95 to 98% chance that that calf's really a PI. That's pretty daggone good. Boyd, how in the laboratory world, that's pretty good, isn't it? That's pretty good. So, yeah, there's nothing wrong with isolating that calf and retesting it in 2 to 3 weeks. But if you're in mass production of moving these animals, sometimes it's just a lot better off to deal with that animal and assume it's a positive and move on. So just some more guidelines as to how we address these issues. We contact the owner or the attending veterinarian to find out what the status of that animal is. Is it still alive? Where is it? Is it with other animals? We use this as an opportunity to educate In a lot of cases, it's the backgrounder who already knows, and in a few cases, it is the cow-calf operator who probably is ignorant of what's going on. And so that's an opportunity to interact with him. And then we present them with the options. I've already gone over them. You can isolate and retest. He can transport them directly to slaughter. He can isolate them on his farm or somewhere else and feed them out and then slaughter, or he can euthanize them. The bottom line is the animal is not to be sold, given away, or transported on the highway without our permission. There are some other things that I think would improve our program. Some of those have already been discussed. Official ID, Neil, I think is a really important thing here. And I would love to see, Sandy, I'd love to see official ID on the accessions so that when that positive calf pops up, we know which calf it is. In many cases, nobody but the owner knows which one it is. And he might decide that calf looks better than that one, so we're going to pretend like that's not the one. When you have a confirmed one, some way to permanently identify them. Brucellosis cows, we used to brand them and put a red tag in them. Well, tags can be removed and changed. The branding probably not look too good by welfare people today, but is a pretty good way to identify that calf. Can we get that done? I don't know whether we can or not, but I think it would be a positive step to give validity to the testing program if we could positively identify them, both with ID and with a brand. All movements documented on a 127. If you're in the regulatory world, you know what a 127, that's an official USDA document where you put them on a sealed van, sealed trailer at one point, and then they're opened by an animal health official on the other end. You know where the animal came from and where it went, and you can verify that. Target education at the cow-calf level. That's certainly the goal of this, because if we could get there, manage the cow-calf level, in reality, the problem at the backgrounder level would be pretty much eliminated. A certification incentive program. It was proposed within our CPH 45 program to include PI testing, and it didn't get any support. It's strange how the market dictates things. When the market's really good, nobody wants to do any of this because they can get a good price without it. When the market's not good, you got to have a better product in order to get the top sale. So with the market the way it is, we're not even having that many CPH sales anymore. Our numbers, Beth, I don't know what their numbers are, but they've been as high as 35,000 in some years, and we're down probably to half of that or a little more? Not much. Also, I had one cattlemen's association in the county had some extra money, and it was a county where they did a lot of backgrounding, and they were talking about, I don't know that they've done it yet, of establishing an indemnity fund so that if people would test and find a calf, they would get something on the top to support their efforts.